You can feel the tension. The setting is a consultation room at a doctor's office. The doctor is somewhat irritated, even angry, and so is the patient. The doctor feels time is being wasted by patients going on endlessly about their problem. The patient thinks that he is not being listened to, that the doctor is not really concerned about anything other than getting him out of the room. Hello and welcome to Prescription. Let's look at an approach to patient care, untested as yet, but has been long overdue and something that inherently appeals to all of us. Whenever there is talk about unhappiness with doctors, three items pop up regularly. We already saw the first one, the tension and the conflict between patient and their provider. Secondly, patients feel that doctors see them as organs with diseases, not the whole person. The attitude is like a car mechanic who looks at repairing a car in terms of the carburetor, the oil system, the electrical circuits, and so on. They fail to recognize that patients, as people, are so much more than just organs. Last, when dealing with chronic conditions and situations where there is no specific cure, they fail to provide adequate explanations, empathy, and support. This amusing rhyme by Hilaire Belloc encapsulates the feeling very well when he says, "Physicians of utmost fame were called at once, and when they came, answered as they took their fees, there is no cure for this disease." In response to all this, a grab bag of systems and treatments are on offer, all of them promising to look at the patient from a holistic perspective, but with different models of treatment. In recent years, mainly due to increasing awareness of the disappointment with modern medicine, a fresh approach to treatment, albeit with allopathy or Western medicine as a core, has emerged. It goes by the handle of functional medicine. Let's take a look. A good starting point would be a quick examination of the way the allopathic discipline works. The body is made up of systems: gastrointestinal, nervous, cardiovascular. Each system consists of organs: stomach, pancreas, colon. Each organ can be affected by a series of disorders. It's at this level that the doctor works and focuses, again, like a car mechanic. There is no attempt to integrate things back with the body as a whole. That's the way it has been for more than a century. This is where functional medicine takes its point of departure. It looks at the way humans function as a whole, the way people live their lives. Nutrition is a large part of functional medicine. Allergens, exercise habits, toxins like tobacco and alcohol are all scrutinized. Stress is analyzed with care. Sleep patterns, genetic background are looked into. And in contrast to mainstream medicine, functional medicine dares to delve into spiritual beliefs and practices. Functional medicine believes that all these very tangible aspects of daily living are where the root cause of disease lies. Once more, the human as a whole. In keeping with this holistic view of disease, the functional medicine physician does not just dash off a list of tests and meds. They may first order tests, blood tests, scans, and such to provide a complete picture. With all this in hand, they will then write out a personalized living plan that will be structured along the lines that we just saw. As far as functional medicine is concerned, there is no off-the-shelf, one-size-fits-all approach. Great. So far, so good. Functional medicine certainly strikes a sympathetic note with us. It seems like the way we want to be treated. But where's the proof of efficacy? The randomized controlled trial is the gold standard of evidence. Any proposed intervention is compared against a control by random allocation. The outcomes are put through rigorous statistical analysis to show that the proposed method is superior, or maybe only equal, sometimes even worse. The sum of such studies forms the evidence base in support. Unfortunately, as of yet, the evidence is either absent or inadequate. It's still very early days. From a practical standpoint, functional medicine is very demanding in terms of time and money. Consultations take on an average of 60 to 75 minutes per patient. Now try fitting that into a schedule where every doctor needs to see a couple of dozen patients per session. For the time being, access to functional medicine is very limited. Still, functional medicine is gaining traction. The world-renowned Cleveland Clinic has a Center for Functional Medicine running in its ambit within its campus for several years now. Preliminary reports sound very promising. As they stay tuned for breaking news on this issue. This certainly sounds like something we could all use.